This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about, does hip bursitis go away? So the answer is yes, it can go away. Some people get it just bothers them a lot and then will kind of go away on its own. But if it's been persisting for a while, then you may need some intervention. So what is hip bursitis? So on the outside of your hip, it's not actually in the hip joint. You can kind of feel it on yourself. You have something called the IT band that goes over the outside part of the hip called the greater trochanter. Normally it's like this. But sometimes if your muscles get weak or other sorts of things, it can start rubbing on it. And when it starts and whenever we have friction in the body, your body tries to eliminate friction, and it puts there's something called a bursa right here, which is a fluid-filled sac, which is supposed to decrease friction. But if it rubs too much, it'll get really inflamed, and that's where you get hip bursitis, or pain on the outside of the hip. Again, it's not in the hip joint, it's outside the hip joint. So the best way to get rid of that, well, there's two good ways to do it. One is to do exercises, which basically strengthen the muscles to keep more space away. If your hip abductors get weak, and abductors are the muscles that let your hip do this, like lift your hip out to the side. If they get weak, you'll start to get rubbing. If you strengthen those along with your core, you'll create some space, and that should help with your hip bursitis. You'll notice that people who have weak abductors, after they've been walking for a while, they kind of start waddling. You may see it in older people or people who've had hip surgery. And then that's kind of where it rubs, and that's how they'll kind of get bursitis. So it's common to see somebody who's maybe doesn't have very strong hip abductors or older go for a long walk, and afterwards their hip is just killing them because they can't support their pelvis anymore and is rubbing. So the exercises are what you need to do to make sure, to help it and make sure it doesn't come back. The other thing you can do is a steroid injection in that area can work wonderfully. Actually, it can, a lot of times it can knock out the bursitis completely. The bursal injections do very well with steroids. That being said, you still need to do the exercises to get your biomechanics correct so it doesn't come back. Those two things combined or separately usually knock it out pretty good. Rarely, very, very rarely, somebody will do surgery where the surgeon will go and actually remove the bursa, but that is like a last resort and it's not done that often. By and large, exercises, a steroid injection, or a combination of both is more than you need, or should be enough to get rid of your hip bursitis. So I hope I was able to answer your questions about hip bursitis. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But know that I can't comment on your specific medical condition over YouTube. If you like this video, we put out new content every week, so please like and subscribe, and thanks for watching.